9 states are reporting cases of patients who received bad Botox. And now the Centers for Disease Control and Prevention has opened an investigation. Illinois is one of the states where patients had to get medical treatment because of bad reactions. So we wanted to know what we should be looking for when booking an appointment for Botox. Danielle Oyasu, the owner and founder of Beautifully New in Park Ridge, joins us now. Thanks for coming in, Danielle.
Thank you for having me, Natalie.
You know, this seems like such a common procedure. I feel like you can get it at the dentist's office these days. You can get it at the med spa on the corner. But what qualifications should an injector have, and how do we make sure that they have those qualifications?
So first and foremost, they should be licensed by the state of Illinois or whatever state you're receiving those injections from. So one of the first things you can do is look up on your state's licensing board, license lookup. So you can Google that, and it takes you right to the page, and license lookup, you can put in their name and make sure they indeed do have a license. That's first and foremost. Secondly, do they have training in these procedures? That's really, really important. So you can call the office. If the front desk can't answer simple questions about, you know, the injector's training or what kind of trainings they've attended, that's kind of a red flag. If they can't answer questions knowledgeably, I would caution, you know, proceed with caution.
And then the last thing you might mention, I kind of jumped in here, is this was interesting to me. So the Botox provider, the pharmaceutical company that actually provides the Botox to these injectors, they have a list of these injectors that purchase from them.
Yes, absolutely. So you can go to the manufacturer's websites, whatever product you're, receiving, Botox, Dysport, they have their own websites, and you can go and find my provider and make sure that provider is listed as an account with that company. They need to have the actual product in hand. I think many providers, unfortunately, are Googling or getting them off of websites that they shouldn't be. I shouldn't say many. I should say there are a few that make this a little more difficult for patients.
Yeah, I mean, and you could be getting anything from an expired product to something that isn't really Botox. I mean, that's really terrifying. And then there's always that if it's too good to be true, it probably is with the price point. So what price point should we be looking for?
So obviously it's dependent on your area. You know, more metropolitan areas, it could run anywhere between $15 to $18 a unit. In the suburbs, you know, you can expect to pay around $12 to $15 a unit.
Okay.
Anything less, that's a red flag.
Okay, so I'm in the injector's office. Hopefully I've already asked these questions. What should the actual Botox product look like?
So you should be able to see that the box or the injection vial has writing in it that is, it's English. So many of these products apparently were written in other languages. Obviously that's concerning. So it's very hard to tell. Honestly, a patient might have a difficult time looking at the box and determining that. But if you ask your provider, where did you receive this product from? That's a perfectly reasonable question. If they can't answer that, then again, you might want to look elsewhere.
So let's say that I feel like the injector didn't have the knowledge, and maybe I'm having issues with whatever work I had done. Is there a place that you can report these people?
You can go to your state licensing board and report them. That would be the first step, and that's really our first and foremost. That's our governing board.
Gotcha. Danielle, thanks so much. This was super useful information.
Thank you so much for having me.
Thank you.